Having done thousands of open and minimally invasive surgeries and many clinical trials, urologist Dr. Chong has gained respect internationally. His private clinic, based at Singapore's Mount Elizabeth Novena Hospital, attracts patients from around the world.
I tend to get complex cases of the kidney, ureter, bladder, prostate.
A health screening found a large 5-centimeter cancerous mass on the kidney of 54-year-old American Terrence Swift. Doctors he spoke with had said the tumor was too big to remove and that the whole kidney would need to be removed. But one urologist gave him hope. Attracted by his experience and very low surgical complication rate, Mr. Swift flew to Singapore to meet Dr. Chin.
They didn't study the scans well. I needed a third angle to the scan. And when I saw that third angle, I knew it was possible.
As Mr. Swift is a larger man of 100 kgs, robotic-assisted keyhole surgery would give him a faster recovery with less pain. The operation was successful, and Mr. Swift was able to get up on the second day and head back into the gym the following week. 4 years on, Mr. Swift lives an active life and continues teaching. After showing symptoms of blood in the urine, 50-year-old New Zealander Truly Davy was told she had multiple bladder cancers. To further complicate matters, her bladder also had a diverticulum, or pouch, full of cancer. Resecting the tumors in this pouch would risk perforating the bladder and allow the cancer cells to spread out. All 3 specialists she consulted insisted the only course of action was the immediate removal of the entire bladder, forcing her to carry a permanent stoma bag, something she was very much against. In a last bid, she flew to Singapore and met with Dr. Chin. Struck by his can-do attitude, she felt optimistic for the first time.
At such a young age of 50, I can understand where she's coming from. After looking at the scans, I found that her surgeon misjudged the severity of the tumors. Actually, they were still just stage 1.
Pioneering a new technique, Dr. Chin burnt the tumors in the diverticulum, a unique solution that hadn't been documented before.
I managed to destroy the tumors, and it turned out well.
After the surgery, Miss Davy returned home. To the amazement of the radiologist and doctor, the repeat scan not only showed no recurrence of the cancer, but the diverticulum in her bladder had completely disappeared. 13 years after surgery, Truly leads an active life helping women and children in Nepal. She still keeps in touch with Dr. Chin and thanks him for giving her the best Christmas present, her bladder. "76-year-old Mr. Rahman from Bangladesh, who previously had a heart bypass, was diagnosed with prostate cancer. His urologist wanted to remove the prostate by open surgery, which carried a high risk of bleeding, with a blood transfusion rate of 60 to 70%. The news sent Mr. Rahman into depression. Open surgery could well compromise his already weak heart. Desperate for an alternative, he flew with his son to Singapore as he'd heard about robotic surgery and the expertise of Dr. Chin.
In robotic surgery, the incision suggests 1 centimeter as compared to open surgery, which would be 15 to 20 centimeters long. That would cause less pain, less scars, and a faster recovery.
Mr. Rahman knew he'd finally found his safer alternative.
In robotic surgery, that blood transfusion rate is less than 1%. That would prevent his heart from being stressed, at the same time get the job done.
I was never worried for a moment because I had great confidence in Dr. Chin.
Mr. Rahman was discharged 3 days after surgery and remains cured to this day. Get your complex urology problems treated with a highly skilled surgeon who goes the extra mile and beyond the textbook for his patients.
I think as a doctor, I think it's important to really feel for the patient. And if you're in a position to help, go ahead. It's a risk, it's difficult, but it's a calling.